Okay, sepsis review, ultra summary. Try to get through this as quick as possible. Sepsis is a life-threatening bodily response to infection. It's confusing because there's so many different kind of ways sepsis starts, but it all finishes in that final common end pathway. And that's really what sepsis is, that end pathway of multi-system organ failure from overwhelming infection. Our job is to cut it off before we get to that common end pathway. And it gets a little tricky because it's so broad out here, it's hard to call. But the earlier you initiate treatment, the better you are. And the good news is the treatments are very safe. So it's something you can save a lot of lives with in a very safe way. Sepsis mortality, sepsis and a STEMI are the same thing. Their mortality is the same. Our interventions drop mortality the same way. If you do the bundle well, you're saving lives at the same rate you're saving lives from a heart attack. Lean toward overtreating. Antibiotics and the 30 cc's per kilo are safe. This is not the time to be an antibiotic steward. We're moving toward the 1 hour bundle. That's what this is about. Every hour that you wait to get these things done, mortality goes up. The best hospitals in the country that are doing this at an amazing level, you see the intensity and they get these things done so quickly, and that's where we're going to be. The goal is to be the best emergency department in the state for sepsis care, and if we can do this 1 hour bundle consistently, we will be. We're moving ahead with this. Highly educated team is what we need that's motivated for success. Bundle requirements: you need an initial venous lactic acid, you need blood cultures, then you need your broad spectrum antibiotics, you need 30 cc's per kilo of normal saline fluid at a minimum rate of 130 cc's per hour. Then you need that repeat lactic acid to cap it off, and then the doctor needs to document the repeat sepsis exam, and you're done. This is the process we need. You're doing an intake assessment. You screen positive for possible sepsis. You're the one that's responsible for making sure that lactate gets done. If the lactate's positive or the blood pressure is under 90, we call a sepsis alert. Clerical, your job, very critical. You're the next step in this chain. If it breaks here, we fail. You page the sepsis alert overhead. You document in the log the time and the D number. I'm going to be reviewing all these. It's important that we, for ongoing getting better at this, we got some work to do and we're going to get there together. And then clerical, if you could do me a favor and make sure the team leader heard that overhead sepsis alert page, because that's the next step in the chain. But everybody in the department needs to be aware that we have a sepsis alert. The doctors, the APCs, everybody may need to get involved, so make sure you page it overhead. So team leader, once it's handed to you, you assign the RN. That's going to be the sepsis expert primary RN. Make sure they have all the tools they need to get it done. Make sure they understand the checklist. Make sure they have the provider orders. Primary sepsis RN, review the bundle, make sure the UTOs are placed, make sure that you put in the verbal orders for the antibiotics and the fluids, obtain high quality access, don't hesitate to ask for help, complete the whole checklist, and then notify the physician that you've changed the patient's life and take a bow. Save the patient's life and take a bow. The second lactate is completed at the 52-minute mark. Provider, your roles, really a lot of this is going to be happening really without your involvement. They're going to ask you for the verbal orders, cefepime, rocefin, 30 cc's per kilo. Get in the room, confirm that the bundle's completed, make sure you do your repeat sepsis exam, document any treatment irregularities thoroughly, because there's a lot of stuff going on. This may not be a patient that you necessarily even think is sepsis. This may be status epilepticus that you're running a sepsis bundle on because you don't know that they have meningitis. So make sure that the bundle completes smoothly, but you have a lot of other stuff you're managing too. So no reason to get too messy in here unless there's something that needs to be modified. If you do modify it, which I totally trust you guys all to do, I know how excellent our team is and how much we've talked about it, document any treatment irregularities thoroughly. Care coordinators, please document a repeat exam and document and remind the physician that it needs to be done and you're doing it there. Again, these are expert level tips. Don't get fancy, stay streamlined, and get this done as quick as you can. Thanks again for watching this and trying to get our hospital to be the best in the state at sepsis care. Give us any feedback. I'll be around, and I want to see how we can get better as quick as possible. Thank you.